Working as a veterinary technician has destroyed my mental health. It's been another awful shift where I work today. I used to love my job as a vet tech, but lately I've started to feel empty. Maybe it's the client who spent an hour screaming at me and the vet that if we don't save their dying animal, they're going to kill and sue us. Not sure which is coming first. Despite my attempts to intervene with the shouting so we may start emergency care for the animal, we needed a signed consent form. When the animal then died, they accused us of poisoning with the pain relief injection they didn't consent to giving. They screamed at us how he was in pain, and we do give pain relief immediately as part of first aid. When in reality, the animal was old and had cancer, which led to an internal bleed. This animal could not walk properly due to the lump size and had not seen a vet in at least 5 years. Maybe it's the client who accused me of laying down the phone and quoting them significantly less for a surgery, saying we butchered his animal who was old and got multiple lumps removed, saying how dare we and why did the animal take so long to heal. They're old and it only took 2 weeks with no complications, but he's still gonna sue me as I, quote, only care about taking people's money. Another person who asked me my name and told me I'm a heartless cow and they will be telling everyone how I don't care about animals when I told them our vet couldn't see his dog this moment because they were in an emergency. I did a full quick health check and the animal was stable. When I told him it's not urgent, he became abusive, said he was going to sue us, bring the police, and tell everyone that I am heartless. I could write a whole book on the abuse I and my colleagues have gotten. This 3 instances all occurred within one 12-hour shift. I am more or less on minimum wage despite my degree and 12-hour shifts. Humanity has just taken it out of me. Customer service has taken it out of me. It's becoming rare that the clients we see are even treating us as humans. Does this get better? How do I get out? Is there an easier career I'm missing out on? Are office jobs truly that bad, and can I get one? I can't afford therapy. I can barely pay rent. If anyone reads this, thank you for even listening. I just do not know what to do anymore. I think I have made a mistake with this career. I'd like to clarify I am lucky that I can pay rent and eat. I know this. I just need to write this and put it somewhere. Thank you to anyone who reads this. Well, my favorite game that I like to play is let's look at all the other jobs that don't require a degree or anything and see how much more they can pay. I usually end up sad at the end of it.
Yeah, that's a really sad game.
I play that weekly.
I think it's just sad that this happens to, like, every tech at one point. Like, we go to school for all this time, and then...
How long?
At least 3 years.
4 years,
4
no?
years.
I
I mean, if you
years.
get your bachelor's for...
Yeah. But 3 if you... They have, like, the certificate programs where the actual schooling is 2 years and then a year of clinicals. And then if you get your bachelor's, you'll do, like, another year of prereqs.
Are you still called a nurse if it's only the certificate?
Yeah, because we have the same degree. One's just, like...
It's the same license.
A bachelor's and everything. But technically, the... like, our license and everything says veterinary technician, but we're nurses, even though...
Your degree says nurse, though, right?
Not...
Our degree...
It depends on the programs. Our degree technically says veterinary nurse because that was the name of our program. It was veterinary nursing. So not a lot of programs are called veterinary nursing. They're still technicians. But we're trying to move away from technician and move to nursing because we do everything that, like, a human nurse would do. For example, like, we do...
More, even.
Yeah, because, like, from my understanding, human nurses specialize in different departments. But, like, what we do is, like, we'll work in, like, ICU, emergency and critical care. We do radiographs. We do surgical nursing, anesthesia, dentistry. We do primary care. I don't know anything else. There's more.
Everything.
You do, like, ABGs. You just did frickin' chest taps today.
Yeah, that was true.
That was fun.
That was fun.
ABGs.
Lab
Like,
work.
Yeah. Pharmacy.
Mhm.
Literally everything.
Everything.
You guys don't have a lot... I almost said at this institution. At this place, you don't have a lot of client interaction as much
No,
as, like, places like...
Which is honestly
Traditional
something
emergency?
I thought that I would really miss, but I'm actually really thankful for because of things like this.
yeah.
You only really see people when you go into the isolation.
Yes, and whenever I end up going into isolation with an owner, it is to euthanize an animal.
Yeah, that's really
And-
the only time I ever see clients
yeah.
is to euthanize.
And it's
So it's
never, like,
never-
a good time.
Yeah, it's never really a good time. Even when they come visit, even if it's like a happy visit, like we're not really part of that.
Yeah.
No, usually
Which kind of sucks.
the doctors will facilitate a lot of that stuff. And the stories that I hear from doctors about their client interaction is, like, absolutely terrible.
Yeah. You guys never get there. I mean, there are rare good client interactions.
There
right?
are
There are a
they're
lot
really
of
good
good.
ones.
But so you guys don't ever get to see that, so that kind of sucks.
Yeah.
Yeah, we don't get it very often.
Whenever we do get it, it's when, like, the clients come back there and they're very upset and everything, and accusing.
A lot of the times, like, also, like, after there's, like, a CPR instance and they put them down back there, you have to, like, stay there and...
Yeah.
Because, like, a lot of the time at that point, they're, like, we're breathing for them, or they're on, like, an anesthesia machine, and we have to, like, manually ventilate for them. So we're standing right there as, like, they're euthanizing and everything. I remember one time I was sitting there for, like, 2 hours while the owner was driving to the hospital and everything, so that way they could be with them.
Yeah.
And that one was really sad.
Do you do that often?
I've done that quite a few times where, like, we have an inpatient or something that codes and we're able to get it back, but the owner's so far away that, but we already intubated. They want to say goodbye in whatever way they can.
At that point, they're basically just, like, brain dead, and we just have to keep them alive long enough, and, like, sometimes it's, like, a struggle. Sometimes they'll code again, and we'll have to do CPR again on them, or we just have to just keep pumping them full of drugs to
keep
them alive.
How do you guys feel about having to do that when they're already gone, just so the owner can say goodbye?
I understand it. Like,
Yeah, I get it.
I know owners need, like, that closure and everything. Like, I would want that closure, but I feel really bad for the animals.
Like, we had a case today, actually, that was a respiratory case, and we put it in oxygen and it started going agonal, and we brought it to the triage table, and we were like about to intubate, and the doctor had just talked to the owners, and she said, like, they don't want to do that. So we had to sit there while the dog's agonal, while the owner comes back to euthanize. And, like, I get that, I do, but it was really hard to watch this poor dog's tongue turning blue.
Yeah, there's only so much you can do.
Yeah,
to keep it comfortable until...
Well, because, like, when they deny CPR, that's not just, like, chest compressions and everything. We can't intubate them to, like, make it so they can breathe
because
or anything. We can't give them any drugs.
In human medicine, there's do not resuscitate, but then there's also do not intubate.
Yeah.
Yeah.
And I wish we had something like that.
Yeah.
Because...
Has anyone brought it up?
I mean, I've talked about it with people at work, but I just don't think that there's any... We just don't do it. And I don't really know why, but because there's just, like, a big gray area with CPR too. Like, are we able to give, like, atropine
Drugs.
and the drugs?
I feel like that's where it's hard, because, like, we can see, like, animals that are, like, breathing down.
Right.
If we give them, like, some atropine or epi or anything to, like, increase their heart rate, that might save them or anything.
Right.
But depending on who's there, they'll say that's part of CPR,
Right.
and we're not allowed to do that.
Right.
Or some people say that's not CPR because we're not doing actual chest compressions, and we can do that.
Yeah.
Right. I've had owners before, I think it was, like, hemoabdomen, like, that they were on the anesthesia table, and the owner specifically said, like, please do everything except chest compressions. And it got to that point, and they did all the drugs that they could. They were already intubated and everything, and heart stopped, and they couldn't do chest compressions.
I feel like that's a good
I was gonna say,
spot to stop. Like,
it's, like, specific.
yeah, and
Yeah.
I feel like that's where I would want to stop, because I feel like I do think doing, like a code is, like, fun, just because, like, I like, not fun, but, like, I like the adrenaline and
Yeah.
everything,
Yeah.
and, like, doing, like, the fast paced stuff and trying to, like, save them. But I think it's honestly, like, just like not okay to do when they're like at a certain point.
Yeah.
Yeah.
And it's just not fair to them, but like feeling like their ribs break and everything, and then they'll start coughing up, like spewing blood because that we've like punctured a lung with a broken rib because we're trying to do chest compressions. I feel like that's just like a very hard part of it. So I definitely wouldn't want my animals to have chest compressions.
Yeah.
Yeah.
I think I always have a hard time deciding what I would want to do. And I think it all depends on why they code it. I mean, if they're
diabetic and...
Yeah, if they're hypoglycemic,
Yeah.
that's the only post-arrest patient I've ever seen go home is a hypoglycemic arrest.
That was a cute one.
Was we gave it eggs so it could go home.
You say eggs?
Yeah,
Like
all we needed
eggs
for it to do was
from a restaurant.
eat. So the doctor and I DoorDashed it eggs because the owner said it likes eggs.
Oh.
And they were running out of money and we just needed to know that it could eat and then it could go home. I never told you this?
No.
The owner said, we need you to know that he's never had store-bought eggs. He's a farm fresh guy. And we said, we're going to do what we could do.
Oh, that's
Yeah.
really cute.
She liked your eggs.
That's adorable.
Yeah. But, so something like that. But I mean, if my dog has cancer, like, can we fix the problem once we get him back or not?
I feel like that's the big deciding factor.
Yeah.
100%.
And everything, because no matter what, if it's a post-arrest, they're most likely going to have to go on the ventilator. Yeah. And like if it's like a respiratory reason that they're like coding, that's never like a good outcome for ventilator cases, like the 2 different types.
Yeah.
What about like heat strokes? Depends.
Yeah.
How bad?
Yeah, I feel like it depends on like what their temperature was and how bad they are.
How long it was and...
That was my first CPR, that heat stroke dog.
Over the summer?
Yeah.
I don't know what you're talking about.
You do?
Yeah.
Were you there?
I don't think so.
Was she there?
No.
No?
I don't think so.
Yeah. Heat stroke dog.
My first CPR
was...
That's a
my first CPR was when I was a student, and this is actually how I decided I wanted to... It's what made me interested in
critical care.
Critical care was hit by car, came in, we got it back in like 2 minutes, and then it's made it overnight, and then owners came and euthanized in the morning, but like they were able to say goodbye. Like the dog was
relatively stable overnight.
Yeah, and I mean he wouldn't have ever made it, but I don't know exactly what his injuries were and stuff, but I think that was really cool. That just made me be like, okay, well, even when it's not a good outcome, at least like we're able to be here to stabilize them and give the owners some sort of closure.
Yeah. It wasn't your dog that made you want to go into critical care?
No, my dog's gonna make me need critical care.
Her Frenchie.
No.
Do you want to elaborate on that at all, or is that not?
We can, yeah.
Okay, what happened?
My Frenchie refused to wear his life jacket. And fell off the dock.
Into water.
Into water. And we thought he was missing for a whole day.
Well, he was missing.
He was under the water. He was in the water. Yes. Now all of our Frenchies wear life jackets.
And they're cute.
They're very cute.
They rock them.
Yeah, they have little wakes behind them.
Yeah.
It's really cute.
I'm sorry.
He washed ashore.
It's fine.
He washed ashore.
He did.
That's dramatic.
It
Papa
was.
found him.
And when I worked in GP, my vet actually got a letter from like one of the old clients. I don't know if I told you about this before. And they basically said they called her a butcher and threatened to kill her.
Oh my god.
And she took it to the police, and they're like,
can't do anything.
Literally. And she's like, okay, I'm not like scared for my life or anything, but sure.
She said, I'm fine.
Does this happen in human med?
I would imagine.
Like, do people get
Have you not
threatened?
seen Grace?
Yeah.
There was a shooter.
Exactly.
But like,
There's...
do people get threatened that much as much in human med?
I feel like they have to because it's...
I heard like the old people homes are brutal too.
Yeah.
Really?
They'll be like, I'm gonna fucking kill you
My
if you
aunt's
try to wipe my ass.
Yeah.
I mean, there'd be some dogs like that too.
Yes.
There was also
my aunt's a nurse, so I can ask her.
Yeah, you should.
How many times have you been threatened?
Yeah, let's compare.
Let's compare.
We had a stalker. Have you?
Yes, we did. What was his dog's name? Charlie or something?
You can't say
No,
that.
I don't know.
And you can't say. Can you?
We can't say names.
Yeah.
Dog's name? No. Fuck.
It's okay. Do you feel like that all
How does that affect you? Yeah.
I was gonna say contributes to your mental health poorly, and like how you are able to cope with things, and do you like just tell me about your mental health more?
I think
In the veterinary aspect, you don't have to get into your personal
Dive
personal
deep. Let's dive
issues.
When did it start? Were you 4?
It all started when I was born.
No!
We'll tell you later.
I think.
You okay? You don't want to talk about that?
No, I do. I just don't want to say.
Do you want me to go first?
Yes, please.
I think it makes me all very sad.
Now elaborate, Sammy. No, I'm just kidding. But
No,
like,
I
what
feel like
aspects, just like, tell me the aspects that don't affect you positively.
okay.
In general.
Here's what doesn't affect me positively. Our pay.
Yeah.
The janitors make more than us that have minimum high school diplomas. That makes me want to cry.
It's just like, how are you supposed to have any self-worth?
Yeah, like it's hard. And then I feel like our patient to nurse ratio makes it hard because I feel like I can't take care of my patients the way I want to take care of them and give them proper patient care, because sometimes we have treatments almost like basically every hour that we have treatments. And a lot of them are really critical and need between like 15 to 30 things sometimes. There's one that like would require like up to 40 items that we'd have to do every 2 hours. And I just feel like I can't give them the care that they deserve to have. And if I do, then I would be sacrificing with other patients. And I don't think that's fair to the patient. I don't think it's fair to the owners. And I just don't feel good about it. I feel like I can do better than what our situation is allowing us to give.
And not even that, but like just like all the people that you work with too.
Yeah, because I want to be able to help my other coworkers and everything with their treatments, with their patients, because sometimes like you're in the least critical section, but you still have so many items. You'll have like up to 20 patients.
Yeah.
And I want to be able to help the other one, like someone who's on another section that has 7 patients and they're all very critical. I want to be able to help them too, but I can't because I'm behind on my stuff. And I feel like that part's just really hard. And then another aspect I would say is when we get like very sad cases, like ones where like they were in a car accident, the owners are in the hospital on a ventilator.
Yeah.
Yeah.
Like
we've
Like
had that a few
fires,
times.
like house
Yeah,
fires.
house fires. We've had that a few times. Or like they're at the hospital, they're not able to communicate currently, so we don't know what they are going to allow for our animals. Or the ones where people will come in, basically surrender their animals and never answer the phone when we're trying to get them to like make decisions, give them updates or anything. And at that point, when we don't have like an owner, we're very limited in what we can do because there's no money to pay for it, which unfortunately is what it comes down to, because if we don't have any money, then we're just going to be losing it. And it just becomes like this whole big ordeal. And then we eventually just won't be able to give care to any of the animals. So I feel like that part is also hard. And then that combined with like we're already stressed and like overworked for these animals, and then combine that with like an environment of all women, well, mostly all women, it can be very toxic just because we're all feeling very stressed and burnt out, and ladies can get cranky, so it can just be very toxic depending on your environment that you're in.
They be talking.
they be yapping.
I feel
not
like
yapping, like not like just on the job. They be talking shit.
I wasn't gonna go that far, but you're not wrong.
you're not wrong.
Oh, and lack of support from supervisors.
Yeah.
And
what people don't realize is we already take everything to heart.
Yeah.
Like if we have, like, we take every case to heart. When we're not able to give our full attention to, like, our most critical patient because we have all these other patients that we have to focus on, like, we know, like, even though we don't interact with these clients a lot, but, like, we know, we talk to the people that do interact with them. We know a lot about their families. We see them come in with their children. We get attached to these patients. Like, we are in this field because we love animals and we want to help them and we want to help the owners. Like, it's not even just about the animals. And people don't understand when they say things like this that we're already a group of people, like, we're empaths. Like, that is the majority of who we are. And so we're already beating ourselves up about everything. Like, we don't like the fact that we have to charge we don't want to charge you nickel and dime you for our care, like, but we also need to be able to get paid. Like, it is our job. We take it home with us every day when we had to see a patient come in that was hit by a car that just needed, like, a leg amp, but they couldn't afford it, so they had to euthanize or something like that. You know, like, we take it all to heart. And it's just, like, comments like that say that we're heartless and that we don't actually care about animals and we're in for the money. We are not in it for the money because we don't get paid.
Yeah.
We don't get paid enough to be in it for the money. And
even, like, the doctors who do, like, make more, like, they're...
a lot of it's by barely, because, like, if, like, their interns or residents, they barely make more than us. Yeah. If not the same.
Yeah, but even, like, the doctors, like, if you graduate and go to, like, a, like, non-emergency or just, like, anything in general, like, if you don't do residency, like, your income to debt ratio is far below, like,
it's crazy.
Or far above.
Yeah. You have a lot more debt than you do income.
Yes, thank you.
This is about my finance majors.
But yeah, like, even just, like, accusing, like, in this story, they accused them of poisoning with the pain relief injection.
But then saying, my dog's in so much pain.
Yeah.
So,
like, there's just some, like, people that, like, everything you do is wrong no matter what. And, like, at that point, it's like, why are you here?
Yeah.
We've had somebody say that, they can't, like, afford euthanasia, and they were like, oh, my brother's gonna shoot him for us. Mm-hmm. And we said, you can't leave.
Yeah. And that's the thing is, like, we will do a free euthanasia. Like, we like, have programs.
They'll work
with you. Yeah. We have programs. You
just have to communicate with them.
Everywhere has some sort of program. Yeah. Some sort of angel fund or some sort of something. And, I mean, our first goal is to always do, like, no harm. And if you bring your animal in that is really sick and needs to be euthanized and you can't afford it, we will eat the cost. Most people would eat that cost because
a lot of
we
times,
do
like,
care about.
We eat the cost when, like, people abandon their animal. Like, we've done surgery and we've eaten that cost.
Yeah.
So how does it affect you?
How does it feel, like, being a vet student and knowing that, like,
this is what you're going into?
I don't know. Obviously, you know about all the high suicide rates and, like, veterinarians.
Don't they tell you that to you in your first year?
Yeah, we had, like, our first month in, we had a suicide, like, lecture, like, just basically laying it out there. Mm-hmm. And, like, there's a lot of people that were, like, severely affected by that. Like, they were like crying and they left. Like, people like sharing stories about, like, how people killed themselves, and I was like, this is a lot.
I said I barely know you guys.
Yeah, literally. I said we did team bonding. That's all. We threw the ball around a circle.
Well, now they're trauma bonding.
Yes, exactly. So, I don't know. I just want to help all the animals and stuff, and I know I'm not going to be able to do that. And you just have to, like, go in knowing that, I guess.
Yeah.
And knowing that, I mean, I've already experienced, like, people saying that we're all in it for the money and stuff. When I like worked at the previous place and had like all these client interactions, we've actually had people bash like our previous clinic. And like that one I was involved in, so it was like a little bit more personal. I don't think I've ever told you about that. They like gave us like a 1-star review and basically said that like this pet that they had like dehiscence, but it was like their own fault because they didn't put the e-collar on. The dog was just like exactly, it was like chewing at itself and like doing that. And then so we tried it again, same thing happened, it opened again, so we're like, okay, we're not selling it again. So we did PRP on it, platelet rich plasma. It like helps to accelerate healing time. And we like gave them all the estimates and stuff, prepared them what they're coming in for. I think they paid for it all up front, and then like they still weren't like having the e-collar on, and they came back for like one of the last ones. Were like, I think you're gonna need to do it again, or like blah blah blah. And then they flipped their shit, and then they were like basically like swearing and like accusing us of all this stuff. And then they posted it on Google review, and then like saying like basically like that we don't care about their pets and we're all in it for the money and blah blah blah. And then so that's
the worst
thing. We're like, we're just trying to help your dog.
You're not keeping the e-collar, you're not doing what we're telling you
and
you need to do.
It was a mass removal for cancer.
Was it mast cell?
Yes. So like we had to get big margins. So like they didn't tell us like that they were gonna take that much off of this tiny little bump.
It's like, gonna come back either way. If you do bigger margins, it'll just keep it gone longer. So it was, like you try to educate them.
Yeah.
And that's all you can really do. I don't know. She almost sued them for defamation, but she didn't.
Oh, the hospital.
No, the doctor almost sued them, the client's review, for defamation.
Yeah. At first I thought you meant the client's almost sued, and I said, for what?
like that's how,
That's why
it could blow up people's business.
Yeah,
Thank God it didn't,
can.
but